How often do we pause to consider the challenges faced by those living with disabilities when accessing healthcare services? This is a question that Mandela, a name synonymous with the fight for equality and justice, grappled with during his lifetime. In the early 1990s, when apartheid was in South Africa, Mandela noticed an urgent need to address the inequalities in healthcare services. He realized that people with disabilities were often neglected, marginalized, and had limited access to healthcare. This was the beginning of Mandela's journey in championing for disability-inclusive healthcare services. Join us in this journey of learning and discovery. Don't forget to subscribe to the SayPro channel for more insightful content. Mandela, in his characteristic proactive approach, started advocating for policies that would ensure equal access to healthcare for all, including the disabled. His first significant step was in 1994, when he was elected as the President of South Africa. Mandela used his influential position to push for reforms in the country's healthcare system, a move that was unprecedented at the time. Under his leadership, the South African government introduced the National Health Insurance Scheme, a groundbreaking initiative that aimed to provide universal health coverage. This scheme was particularly beneficial to people with disabilities, as it ensured they received the same level of health care as any other citizen. Mandela's commitment to inclusivity did not stop there. He understood that providing equal healthcare services was not enough if the facilities were not disability-friendly. Therefore, he championed for the construction and redesigning of hospitals and clinics to accommodate people with disabilities. This saw the introduction of ramps, wider doorways, and other necessary modifications to make health facilities accessible. In the early 2000s, Mandela's focus shifted to mental health, an often neglected aspect of disability. He recognized the stigma associated with mental health conditions and made strides to normalize conversations around it. Mandela's efforts played a significant role in the development of the South African Mental Health Policy and Strategic Plan, which has been instrumental in providing mental health services to millions of South Africans. Mandela's legacy in promoting disability-inclusive healthcare services is evident in the strides South Africa has made in this sector. His efforts have not only benefited South Africans, but have also served as a blueprint for other countries in their quest to provide equal healthcare services for all. To summarize, Mandela's efforts in promoting disability-inclusive healthcare services began with his recognition of the inequality in healthcare services. His proactive approach led to policy changes that provided equal access to healthcare for all, including the disabled. He championed for modifications in health facilities to accommodate people with disabilities, and later shifted his focus to mental health, which resulted in the development of the South African Mental Health Policy and Strategic Plan. Mandela's legacy continues to influence disability-inclusive healthcare services, not only in South Africa, but also globally.